Here in Warwickshire, we have a new intake of children joining the schools and therefore going to be supported by the school nursing team. So just over 5,600 parents have been contacted in order to try and get them to complete an online health questionnaire. The questionnaire itself will then give them some signposting, give them some websites and some points of contact, and then they can come to the school nurses team if they have any further advice that they're looking for. We need to make sure that we're communicating with the right people. So the information has been provided by Warwickshire County Council from the school admissions team. It's really nice for us to introduce ourselves as the school nursing team in Warwickshire, and that parents have directly got our contact details already. Between June and September, we have a handover period with the health visitors. So if they're a health visitor supported child and it needs to continue with the school nursing team, then that will be a separate process. So everybody knows that there's a health visitor. We're just trying to get the message out there that also when your children go to school, there is a school nursing team that are also able to support you. We have a text messaging number, so we're promoting the text messaging line so that people can just give us anonymous text messages. But also they know that our website is there for additional support and signposting, or they can call us and they can get advice over the telephone with one of the nurses. We're that point of contact. We're the linchpin between the parents and the school nurses who are able to then provide the support. So we'll be taking referrals over the telephone. We'll be supporting parents if they're struggling to access the portal. And we can also try and come up with some suggestions if they do struggle at home to get online, whether there's local communities and venues that they can go to, or whether we can talk to school and see if they can use the resources in school, just to try and get that information from the parent in order to make sure that they're assessing their child's health and development. Out of all of the email addresses, there are only, all of the children, there are only 40 that didn't have an email address against them. So it's a very small proportion. But because we're also emailing through schools, we're hoping that we'll capture it through that route. But also we're at community venues. We're putting posters up in the local GP practices. We're putting them up in supermarkets. So wherever we think that a young person may be, their parents may be, we're trying to get that out there. And also targeting the nurseries. So a lot of the young children are at nursery at the moment. So we're targeting specifically the nurseries to try and introduce ourselves that route as well. We will be sending out more emails to remind the parents, to remind the schools, but we love being able to be that linchpin between the parents and the families and the school nurses and getting the support that they need to make sure that children are healthy.